My computer is working on updates. It's 0% complete, but I do have the agenda pulled up on my phone, so.
Okay,
just
and I've
when
got it here, so,
Well, I'm good, thank you.
yeah.
Just as long as everyone else
You
is.
can read that small print. so.
Yep.
When they do a presentation,
my usual.
they'll put it up on that screen over there, and then we can watch it closer.
I can read it on my phone, but I don't like it.
Thank you.
I still haven't looked
We
at
try
those
to
blue
keep
blocker
really
glasses.
good
I've been
technology going here.
intrigued by those.
So should I turn this on?
It's,
Virginia, what part of the county do you live in?
when I was
I live in Lutzen.
working just
Yeah. Yes, I have a little bit of a drive.
20 years, I used those when you got into the point where you're doing a lot of computer work, and it made
And I have
just
the
such a
only,
difference in the
townships
stress
in the
you'd feel on
county.
your
Sure, oh
eyes.
yeah,
And I have
I
those
believe it.
meetings.
I feel, yeah, my body, both my back and my eyes after.
Lutzen Township meeting.
Is Debra
So I
coming
usually
this
try to
morning?
go
I
on,
haven't.
give them updating,
I'm
you know,
assuming
what's
she
going on.
is.
She tried to call me last night, but I
They're all
wasn't able
trying to
take
do
her
the
phone call.
Zoom.
When I called back,
so
there was
that,
no
you
answer.
know, so if the weather's bad.
And I had emailed her several
Schroeder's had
times
it
and didn't hear. I
Quite a while.
finally got a
Lutzen is
response
just
back.
trying it now, so I'll see tonight.
She said things were okay.
If they're
That's what I was
successful.
concerned about. When I didn't hear,
Well,
I'm
that's
like,
what I'm not,
are
I
things
just thought,
okay?
well, that's okay,
We'll see.
whatever, I'll talk to you in the morning, but.
So the email she sent said things were okay, so.
Well, I hope so.
Hope.
We'll just wait till James gets back. We won't wait for my computer.
Is it still at 0?
It's
It's
still at zero.
zero.
You know, it takes a little while to warm up, you know, and then it'll. I'm not worried about it.
Was
Oh,
it-
Mine
was it
did that the other day.
Was it
and
in
I
the car?
just like- No, it's
Not
updating.
overnight, yeah.
Updating.
It intrigues me because when I shut it down, I put update and shut down. Well, here we are, updating. I could have just shut down.
Joys of technology.
See, now, James, now you got me thinking.
We have plenty.
But then I also thought, Allison's way over there.
What's up? Are you trying to make eye contact? Sorry.
No, I'm just making small talk.
Packing it in.
I'm just making COVID small talk.
Oh, yeah.
But I think, are we ready?
Well, we're not quite at 8:30.
Okay.
Assuming that clock is correct.
Yeah.
is it?
It's 8:32, actually.
That's what I have too.
And that's, yeah,
Faster than this one.
that's what my phone would have.
Yeah, that clock has been losing time.
Well, let's roll, if we may. Yeah. Oh, we are rolling. Yeah. Good morning, everyone. Welcome to the Cook County Public Health and Human Services Board on this Tuesday, January 16th at 8:33 a.m. I'd like to call this meeting to order. And the first order of business is the election of the 2024 Board Chair and Vice Chair. I am the current chair, Commissioner Sullivan's the current vice chair. I am willing to continue as chair. I am also very willing to not continue. So if anyone has any thoughts and preferences, please share them, make some nominations or general discussion here. I think as far as bylaws are concerned, we put forward a slate and then vote on it via ballot, or how formal would we like to be with that?
Well, Mr. Chair, I make a motion that you continue as chair
Okay,
for 2024.
okay,
And I'll second that motion.
okay. We have a motion for me to be as continuous chair. Is there any discussion?
I think you do a good job.
Thank you. Okay, all those in favor, signify by saying aye.
Aye.
Aye. Opposed, same sign. Motion passes unanimously. And then on to our vice chair, Commissioner Sullivan. Would you be willing to serve as vice chair?
I
or-
am willing to continue in that role, but I certainly would be happy if someone else would be interested in serving that role.
Doesn't look like there's interest. I think you had to sub for me maybe a couple times or more. Okay. Thank you for that, by the way.
Absolutely.
In which case, I'll make a motion to have Commissioner Sullivan as our vice chair on the Public Health Human Services Board. Is there support?
As one of her happy constituents, I will second the motion.
Thank you.
Thank you, Craig. I have a motion and support. Any further discussion there? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you, everybody. That moves us down to our consent agenda, which includes our meeting agenda, the minutes, financial report, abstract and bills, renewal of purchase service contract between PHHS and the Center for Alcohol and Drug Treatment for Detox Services, approve the hire and promotion of Izabela Sheehan for Eligibility Specialist, and appointment of 2024 Advisory Council officers. Is there anything in the whole agenda that we need to add or amend and/or within the consent agenda?
I'd move to approve the consent agenda and the agenda as written.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Support.
Thank you, Commissioner Hawkins. We have a motion and support. Any further discussion? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously there. Thank you. Very good. Moving on to our staff report. Director Alison McIntyre for our 2023 Department Year in Review. Good morning.
Good morning, commissioners, community members, and staff. This is my 6th report to the Public Health and Human Services Board. Rather, my 6th year-end report. I've given many more reports than that in my years. I'll take a similar format as in previous years. I'll start with an overview of staffing changes. Our staff are the most important part of our department, and any significant changes to our staff are significant to our department and our mission. I'll give a high-level overview of what has changed with regards to our caseloads and the number of calls and requests for services that our department responded to in 2023. This year, I'm going to provide additional historical context of caseload data looking 10 years back. I'm going to give a brief overview of new programs and services from the year and an update on our outreach and engagement work as a department. Next slide, Melissa. The Public Health and Human Services Department includes 6 primary areas of service with 4 human services units or teams, the first being adult and home and community-based services, who primarily serve residents with care coordination, case management, vulnerable adult investigation, and other services to older adults and persons with disabilities in our community, in the care center, as well as residents who are receiving care or services outside the county. The behavioral health team includes staff who provide adult mental health case management, children's mental health case management, substance use disorder case management, and treatment coordination. We also contract with Greg Barnier for substance use disorder assessment and treatment services. Within Children and Family Services, staff provide mandated services including child protection, investigation, and case management. Parent Support Outreach Program, which provides support to families to maintain stability and prevent out-of-home placement, as well as licensing of family child care and foster care providers. This team also includes our innovative new child care coordinator position that's paired with that licensing role. Within Economic Assistance and Healthcare team, those staff administer federal, state, and local programs that help residents meet basic needs and access healthcare services. Our Public Health team provides community health promotion, infectious disease prevention, public health emergency preparedness and response. Our department also contracts with a number of service providers in the areas of child support, substance use disorder assessment and treatment, in-home support services, and a wide range of public health and community health programming through the Sawtooth Mountain Clinic and North Shore Health. Our administrative staff work across all program areas, providing customer service, coordination, contract and grant management. Fiscal staff perform mandated grant reporting duties, receipt of state and federal funds, estate recovery, billing for services provided by staff in licensed programs. Turnover was once again a driving factor in our department last year. 14 positions turned over in 2023, approximately 41% of our team, topping last year's high of 12 positions. Of those staff, combined had 65 years of service to the Public Health and Human Services Department, so a significant amount of institutional knowledge left our department in 2023. 7 staff had over 5 years of experience, 1 had 16. The impact on the team was profound. While staff and supervisors worked to ensure continuity of service by taking on additional on-call or intake shifts, cross-training staff in on new programs, and dedicating time and resources to onboarding new staff into their roles. Again, this is an all-time high level of turnover from our department. Last year was 12 positions. Prior year average was about 4. Other than the increase, what's notable about 2023 was the high number of internal transfers and promotions versus people leaving the agency altogether. Of those 14 positions that turned over last year, 5 of those were resignations. 1 was a retirement. There were 2 internal lateral transfers, so from one similar classified position to another, and 6 promotions. Again, 57%, over half of the positions that turned over last year, those staff are still with the department in different roles. Prolonged vacancies were also a factor in 2023. We had 3 positions that were vacant for over half of the year. Those being the Family Services Case Manager, that was vacant from July 2022 to June 2023. Adult Mental Health Case Management position that has been vacant since February of last year. And the Coordinated Crisis Response position that has been vacant since April of last year. In response to the significant turnover, our staff collectively logged over 1,000 hours of overtime or earned compensatory time in excess of their regularly scheduled hours. We welcomed 8 staff to the department in 2023, 1 of those being a new position. All of the other hires were backfilling resignations or retirements. Those staff are listed there. Again, 6 staff found new opportunities with the department or within county government as a whole.
Melissa, is this supposed to be advancing or no?
Oh, and Melissa, if you can advance slide. Those are our new staff that we welcomed in 2023. Again, just one of those being a new position with the department. All the rest were backfilling vacancies. And the 6 staff who were promoted in 2023 are listed on the next slide, please, Melissa. Thank you. So 5 internal promotions to our department and 1 to the broader county government. So what was going on amidst all of that turnover? Across nearly all program areas, our human services staff provided services to more individuals and families than in recent years. The economic assistance team worked with 166 households, or 267 individuals, receiving cash and/or nutrition assistance. With the economic assistance and healthcare programs, this is a snapshot, a moment in time. This is not over the year as a whole. This is as of December of last year. So that figure is down from 199 households as of December 2022. During this time, 718 households were enrolled in medical assistance or a Medicare savings program. This is down from 733 in 2022. Within those 718 households, a total of 1,208 individual community members were enrolled in a Minnesota healthcare program as of December 2023. That includes medical assistance, Minnesota Care, or a Medicare savings program. This figure is also down from 2022, but does represent just about 20% of our population here in Cook County eligible for a Minnesota healthcare program. An important caveat on these decreases is that it does not represent a decrease in workload. On the contrary, our staff has been as busy as they have ever been, responding to the huge volume of renewals that are due for the first time in 4 years following the unwinding of federal pandemic-related waivers. A 4-year backlog, in fact, of renewals. In December and January alone, staff had nearly 200 eligibility renewals due, which has resulted in a huge volume of calls, emails, and walk-in requests from community members concerned about maintaining their health care coverage.
Alison, I
Yes.
just had a thought there on that, on the numbers, trying to think of like why we would have a decrease, right, or why we'd have a change. One reason could be because of eligibility changing. Another reason could be people leaving the area, and another reason could be people working out of the need for assistance. And it's hard to really suss out all of what's going on, but I just wanted to acknowledge those, 3, I think, likely reasons. Probably can't go too deep in the numbers about that, but.
No, those are the exact 3 reasons I had listed here,
Yeah.
contributing to the decrease in workload. People earning more money, people impacted by the unwinding of those pandemic-related waivers, not just in healthcare programs, but in nutrition assistance and cash assistance as well. That has impacted individuals and families who had to renew for the first time last year in a number of years, as well as you mentioned, people leaving the community and passing away.
Did you already say that, or did I get it? Oh,
Did you
okay.
say that? I'm not sure.
No, well, that's why I was just like, you said you had those listed, and I was like, did I miss that when you were talking, or did I get ahead of you?
I don't know.
Okay, good.
Probably a little ahead of it.
Okay, good.
Brilliant minds think alike.
All right. Within our social work teams, staff responded to 431 intakes across all human services programs in 2022. That is up from 424. And actually, I reran the numbers last night as I knew that staff were still reporting data, so that I didn't update on that slide, but in my next slide, which I did update, it increased to 435. So again, that's 435 intakes in 2023, up from 424. Melissa, can you take us to the next slide? So this is the first time I've reported 10-year history on intakes. Here you can see the increase, at least over the last 4 years in 2023, up to 435. This is an increase of over 100 intakes from 10 years ago. Again, pretty clearly demonstrates the increased workload that we're responding to as a department over the last 10 years. We are down 40 intakes from that 10-year high of 472 in 2016. What was going on in 2016, you might ask? We added a second child protection social worker in 2016. This was following the state level mandate and additional funding for child protection following a governor's task force and significant statewide reforms to the child protection system. In 2016, we also reorganized our social services team from one supervisor overseeing a wide range of services to two. Martina Johnson in 2016 was promoted to the adult and home and community-based services team, creating two social work teams, one working primarily with children and families, the other is working with older adults and persons with disabilities. In 2016, we had 114 child protection intakes alone, so that was our 10-year high for reports of alleged child maltreatment to our department. Looking at 2023, high-level breakdown of where those intakes occurred by program area. Out of the 435 intakes in 2023, 39 were for adult mental health, 148 were for general adult services, 84 were for chemical dependency or substance use, 82 were for child protection, 35 for child welfare, and 19 within children's mental health. So those are the intakes by program area in which there were 10 or more intakes. I didn't include the programs that had 10 or less. Another way to look at our workload in human services is at the caseloads or work group. Next slide, please, Melissa. Here again, you can see a huge increase in 2023 in terms of the number of individuals and families that our team was providing case management services to. This is an increase of nearly 100 from last year and almost double the individuals served in 2013. Next slide, please, Melissa. This is that same figure broken down by children. So this is the number of unduplicated children in work groups by year from 2013 to 2023. Again, significantly more this year than any other year in recent history, last year rather. Next slide, please. Same for adults. Twice as many adults in work groups as in 2013. 442 unduplicated adults in work groups in 2023. So in addition to our increased workload serving individuals and families in the community, our staff partnered with other organizations on a wide range of new programs and services, all founded on the goals set forth in our 5-year community health improvement plan. 2023 marked the first in a new 5-year community health assessment cycle. Throughout the year, 35 community members came together in a series of 3 community meetings to review relevant health data from local, regional, and state level reports and data sets. These groups shared a vision for Cook County where everyone deserves the opportunity to be the healthiest version of themselves. During these meetings, community members discussed health outcomes, as well as the various causes and contributors to challenges with health. Ultimately, participants voted on their top 3 areas. Collectively, the top priority areas defined by community members were affordable housing, mental health resources and support for well-being, affordable quality childcare, transportation options, affordable healthy foods, and physical health services. Conversations will continue throughout the 5-year cycle about how community agencies and the Public Health and Human Services Department can work to address these various priority health areas. The community health assessment is required of local public health agencies every 5 years under Minnesota state statute. This report forms the basis of our community health improvement plan, which will be under development over the course of the next 5-year period. Next slide, please.
Alison, I'd just like to point out.
Yes.
Correct me if I'm wrong. Back up a slide, please. Thank you. The community health assessment priority areas are also the basis of the discretionary grants.
Yes.
All grant applications have to address one of the priority areas.
Thank you for that comment, Frank. Yes, an important connection there, that this health assessment is aligned with the request for proposals that we send out every year to nonprofits in the community for the Public Health Fund, which is, that process is led by a subcommittee of our Public Health and Human Services Advisory Council. Thank you, Frank.
It's a very significant, actionable items here.
The community health assessment also acts as a strategic plan for our department as it relates to new grants and new programs and services. In 2023, department staff led and supported program and service development aligned with our last 5-year community health plan and many of the same priorities identified for the current year. This was year 2 of the Rural Communities Opioid Response Program, a 3-year federally funded grant partnership between the University of Minnesota, Grand Portage, Sawtooth Mountain Clinic, and Cook County. Through this grant program, staff in our department are increasing our work alongside these partners, local schools, and other service providers to expand access to substance use disorder prevention, treatment, and recovery services. In 2023, our team worked to expand access to overdose prevention supplies and education through a series of naloxone Narcan trainings hosted at Cook County Higher Education. Our department also became an official naloxone access point in 2023. And later in the year, a substance misuse prevention coalition was formed with an open house kicking off that effort in late November. Additional engagement sessions are planned throughout 2024. While the coordinated crisis response position remained vacant for much of 2023, department staff, along with our partners at the Sheriff's Office, Grand Portage Human Services, North Shore Health, and other regional mental health service providers, continued our work to develop the infrastructure and collaborative relationships required to provide a more streamlined and supportive process for responding to individuals experiencing a mental health crisis. Calls to regional and mental health lines are now referred to mobile crisis teams within the county 24/7. We put out a media release just before the holidays to describe what happens when you call or text 988 in Cook County. Also in 2023, a series of initiatives to support the local child care and early learning system kicked off, including the first year of the Cook County Child Care Wage Enhancement Program. All eligible providers throughout the county and Grand Portage have participated in that program and are sharing positive feedback about the difference that this has made for their program's sustainability. This is continuing into 2024 with a cost of living increase approved by this board. This program is unique and is garnering interest across the state and region. Our child care coordinator and some of the initiatives that we are partnering with other organizations on locally will be featured in a PBS documentary this year. Launched in 2022, the Healthy Housing Program connects trained public health staff with homeowners, renters, and landlords through evidence-based healthy housing assessments to identify housing-based health threats. The Healthy Housing Network was also established to engage multiple perspectives and advise the department as we build capacity to address the link between health and housing in Cook County. Staff conducted 25 healthy housing assessments from the program launch in late 2022 through 2023. In late 2023, staff partnered with the Housing and Redevelopment Authority, or HRA, to bring in additional grant dollars for a new pilot program to connect past participants with the Healthy Housing Program to additional funds aimed at improving the envelope of their dwelling, so the windows, siding, roof. Our department is continuing work in collaboration with care partners on a needs assessment that focuses on the perspective, experiences, and concerns surrounding aging in Cook County. In 2023, staff at Public Health and Human Services and care partners of Cook County hosted 7 in-person forums, 1 virtual forum, and received over 100 survey responses to an age-friendly communities survey. The action plan to be developed after the forums and survey data collection is complete will provide a framework for applying for grants and developing projects based on the identified community needs, with the goal of making Cook County a more age-friendly community. We continue to seek input through the local survey through January and plan to share findings back to community members and elected officials in early 2024. Next slide, please, Melissa. Melissa made this nice infographic for me that shows a breakdown of some of the larger grant funds that our department secured in 2023. These are all competitive grant funds that required a great deal of effort on behalf of our team and collaboration with the other community partners involved in this work. Child Care Solutions partnership with EDA was a $180,000 grant. Another larger grant was the Healthy Housing Grant through the Regional Community Health Board. Just a note that this covers 2 state fiscal years. The grant started in July 2022. However, most of the work took place in 2023. That was $57,000 over those 2 years. So in total, over $367,000 in grant funds brought into the community by our department and our collaborative efforts in 2023. Next slide, please. Our team also continued to conduct regular outreach through the creation and sharing of high-quality content on social media in 2023. We continued to grow our reach with these pages with 63 new followers on Facebook, up to 877, and 49 new followers on Instagram, up to 406. Each month, staff present to the Public Health and Human Services Board on specific programming areas and contribute to 12 Cook County News Herald articles and well over 12 WTIP interviews each month on North Shore Morning and on Daybreak to help reach more people and provide information on services provided by our staff. We distributed 35 media releases in 2023 on a wide range of topics, from suicide prevention and harm reduction to vaccine recommendations and tick safety. Our department is not only sharing information on our work, but we are also listening to the voices and experiences of community members as we work to develop new programming and prioritize our collective efforts around health improvement. This happened through our community health assessment, the age-friendly listening sessions, and again, more recently, through the creation of the Substance Misuse Prevention Coalition. Next slide, please. The Public Health and Human Services Advisory Council and the Cook County Local Mental Health Advisory Council were both active in making policy, service, and funding recommendations in 2023, as well as conducting outreach and fostering connections across providers and service organizations. Both advisory councils welcomed new members last year. The Public Health and Human Services Advisory Council remained engaged with community health improvement plan activities, and a subcommittee of that council reviewed applications from community nonprofits for public health grant funds, recommending $150,000 be issued to support those organizations in the 2024 budget year. I did not prepare year-end reports for each of these councils as I've done in the past, but we'll be working on that in the months ahead to summarize the work of these citizen advisory councils and present at the February or March Public Health and Human Services Board meetings after those groups have had a chance to review and provide feedback on the year-end reports. Next slide, please. Goals for 2024. Filling vacancies. We currently have 5 vacant positions on our team. This is the #1 priority going into the new year, as staff stability is essential to achieving our mission. When staff are taking on more than is possible for one person in a high-stress field, as you all know, this is unsustainable. Turnover will continue. So filling those vacant positions, providing support, training to our staff is the first priority. Additional goal for 2024 is continued efforts to document some of our internal procedures. The turnover we experienced in 2023 and 2022 reinforced the importance of documenting our procedures, especially when people with years of institutional and community knowledge leave their positions. Just an example of one that I've been working on is a procedure for responding to data requests. We're experiencing an increased volume in requests from members of the public for public data, and particularly from individuals requesting their own data. We don't have a clear process. It involves a lot of coordination between myself, the department supervisor, our staff, and the county attorney's office to respond timely and appropriately to those requests. Also, for 2024, a significant initiative will be the transition of our electronic document management system. We will be migrating our economic assistance and healthcare document management system to CaseWorks, following the lead of St. Louis County and others in the region. And we'll also explore investing in an electronic case record system for social services. Contract and grant management is also an area that I am prioritizing for the year ahead. We contract out a wide range of services. You heard me speak to the number of grants that our staff secured in 2023. This is a significant lift for our fiscal team. Rough estimates is that we have doubled the number of contracts in the last 5 years. Again, a rough estimate, just looking at the contracts that we have saved in our electronic SharePoint, we were at 26 at year end of 2023, which is double that of the 13 that we had in 2019. So having a more streamlined process, consistency in terms of the approval and review process. My practice is to look back at what we've done in the past, but would really like to take a more proactive and thoughtful approach going forward for 2024. As an example, the Public Health and Human Services Board has delegated authority to me to act as signatory for all of the public health contracts that come through the Community Health Board. As we have frequent changes, there are, I don't even know how many grant contracts that come through the Community Health Board, many that we then subcontract out to the Sawtooth Mountain Clinic. I'd like to explore a similar model for some of our other Department of Human Services contracts and grant agreements, with the goal of balancing the transparency required and efficiency and not having multiple rounds of review and signature. Having conversations with other directors in the region to learn more about their contracting processes, as every county is a little different, but I think we can learn from our peers in this regard. Another personal goal for 2023 that remains a goal in 2024 is a commitment to ongoing engagement in state and regional advocacy and professional development through statewide associations. I was reminded in 2023 just how essential it is to stay connected with peers locally, regionally, and statewide. It's so important in this work to have that perspective and to maintain that sense of hope and optimism for a better future through systems change and collaboration. That's all I've got for 2023. Happy to take questions on my presentation before I move into my staffing and department updates.
Thank you, Allison. That's a lot and gives quite the perspective for us. Any questions?
I'd just like to share my appreciation for the look at the last 10 years. I think that that is really a valuable view of the increase in workload that we've had and the need that we are experiencing in our community. So thank you for that perspective.
Thank you, Commissioner.
Well, please continue then. Or do you have a?
Yeah, I guess I do have a question.
Yes,
if
please,
it's okay.
Commissioner.
You're talking about the data requests, and you say it's public and individuals requesting their own data, and I'm curious, that kind of surprised me. Who in the public, is it like news organizations, or who requests data from you? Schools, or?
That's a great question, Commissioner Hawkins. I can describe just based on my experience. It could be a media request. It could be a member of the public who's looking for updated information on the number of individuals we're serving within a specific program area or across all programs. County Attorney Higgin?
I can continue the list if you'd like.
Yes,
I can
please.
think of a few different ones. Yes, so individuals requesting their own file, sometimes for purposes of like a custody, court action, or it's a parent who's across the country and the other parent is parenting here and they want to know what's going on. Sometimes it is media organizations related to like the number of child protection reports or various policies they want to know about because they're going statewide. Yep, those are some of the ones that I can think of.
It may be an individual requesting their own data for employment purposes. It might be related to other programs that they're applying for.
Okay, that's fine. I didn't understand what that meant, so thank you for clarifying that.
Other organizations might file a data request to get client data related to a disability determination. It's a wide range.
Good question, thank you. Any other questions? Okay, please continue, Alison.
All right, so I'll be brief in my staff and department updates. You've heard me talk a lot already this morning. I'm just going to send a quick message to one of my colleagues here, see if they can join. All right, so staff updates. You approved Izabela's promotion to the economic assistance team. She will be transitioning mid-February, which means we are now recruiting for several support staff positions on our team following 2 internal promotions and a resignation back in October. We continue recruitment for the adult mental health and coordinated crisis response positions, both of which have been vacant for over 6 months. In a step to improve our recruitment efforts for the coordinated crisis response, we have recently reviewed the job description and aligned it with other social work job descriptions in our department. Department updates. We are now distributing harm reduction supplies in our lobby. A media release went out last week with our efforts to increase access to those life-saving overdose prevention supplies without having to come through our front desk to make that request. This month, the Cook County North Stars Early Childhood Campaign is launching. This is with the support of that grant we received in partnership with the EDA through the Department of Employment and Economic Development. The website will go live any day now, and we're already starting to see some of the social media content going out locally. And again, this is outreach campaign aimed at recruiting additional providers for early childhood and child care throughout the community, promoting some of the efforts that our department is leading, including the wage enhancement program and professional development support to people looking to become child care providers. Wanted to share follow-up from, I think, a couple of months ago now. I believe it was Commissioner Hawkins had asked a question in response to our financial report about just looking for a ballpark of some of the rates at the regional treatment centers in the state to help provide context around our significant overspending in that line item in 2023 for some of those court-ordered mental health placements. For Anoka Metro Regional Treatment Center, the per diem rate, so daily rate, is $2,000, over $2,000. For child and adolescent behavioral health services, that per diem rate is $3,496. For some of the community behavioral health hospitals throughout the state, that per diem rate is over $1,800. I'm happy to share the Department of Human Services bulletin that lists all of the rates by program area if you'd like additional detail there.
That's quite the perspective right there, though. Holy
Yeah.
smokes.
A quick note on the financial report that you approved under the consent agenda. This is preliminary, as staff are still making journal entries for year end, and as quarterly billing and reporting is underway. We will continue to bring in revenue through Q1 of 2024 for 2023. Plowman will present a year-end financial report in the first part of the year once those numbers are all finalized. Not a lot of changes from previous months in terms of where we are significantly overspent. Those being in some of the voluntary children and family services, mental health services, again largely due to adult mental health placements. We had additional revenue in social services collections as a result of unbudgeted one-time payments related to analysis of the Title IV-E reimbursements, which are federal funding to offset the cost of care for children in out-of-home placement, additional North Star revenue, placement aid, and out-of-home placement recoveries made by the department. Right now, I am killing time in the hopes that John will be down here shortly to join me for
What was
the
that last-
update on the coordinated crisis response pilot. Yes, Commissioner.
What was that last, you said North Star?
North Star Care is one of the programs related to out-of-home placement and funds to support families for relative placement. So that is the 240% collections for social services and out-of-home placements. So again, over double what we had budgeted in that area, and this is a one-time payment related to analysis of these various reimbursements, state and federal reimbursements for the cost of youth in out-of-home placement.
Not to be confused with the North Star.
North Stars, yes.
You're right. That sounds like, oh.
The Cook County North Stars Early Learning Campaign, yes. Any
Great.
other questions on my staff or department updates, the financial report?
I just wanted to share some of my hopes for 2024 and just wanting to be, again, more proactive, more preventative, and just, I think we've done really great work with the childcare initiative and trying to support the childcare workers. And, we still have a very strong need there. I think housing is at the root of all of it. I think the wage enhancement helped a lot, but without a larger pool of people, it seems like you're kind of pushing a rope or whatever. I also want us to think about the affordability for families, because the first initiative was really trying to bolster and strengthen the providers so that there is a service, but then we also need to make it affordable for families, and that's, I'm sure, a much more expensive, potentially a much more expensive route, but we can phase in or do a spectrum, of some kind of support, just so that we can really target those in need and support families as well as providers. But one other thing that I'm really hoping that the department can help with is the restorative justice program. The presentations and education I've been getting about that is just remarkable, and I'm hoping we can get some representatives from Carleton County here to talk more about their program and their system. Not that we have to replicate that, but it does give a really powerful impact to the community, and so it'd be good to hear from them. There was also another program that I'm not as familiar with, but also had very impressive numbers, called the Yellow Line program. And I don't remember which county it was. I think it was in the southern part, maybe Dakota. I can't remember.
I think it's Blue Earth County.
Blue Earth?
Commissioner, where that was first piloted, the Mankato area.
Mankato, thank you. Okay. So I'd like to maybe look into that a little bit and just see if that's something that we can piggyback on or incorporate, just if there's a spot for that in our community too. But those, both restorative justice and the Yellow Line, are more on the preventative side, really trying to get ahead of problems. And I guess maybe the Yellow Line is kind of parallel, maybe not necessarily ahead. So, but when we're looking at our huge costs, those potentials for care ranging from $1,800 to $3,500 a day, I think it's money well spent if you're just looking at it dollars and cents wise. And then also I feel like it's in line with our community values too. Really trying to help people from the get-go. Does anyone else have any goals or hopes for 2024 for the department? No pressure, just
Maybe
open.
this isn't the
Anna?
department, but the childcare at the Congregational Church is just starting
Yeah.
finally now, I think this week or maybe last week, and it's been a long time coming and getting all the ducks in a row, and so it's really good to see that
Yeah,
finally
absolutely.
coming to fruition.
Yeah, it's very exciting.
Well, I'm happy to launch into an update of the Coordinated Crisis Response Pilot and anticipate that John will be here any minute to help address questions.
Well, and if you'd prefer, we could also go on with our committee reports if you wanted to wait for John, or whatever you would prefer.
It's all right, I can
Oh,
start
right.
talking. And
Yep.
So again, despite that position being vacant for most of 2023, our work across systems continues in earnest to improve processes and relationships for responding across systems to individuals in crisis. John, who's the supervisor of our behavioral health team, is that point person while the position is vacant for any daytime crisis calls that come to our department. Again, daytime crisis is that gap that we are responding to in the creation of this pilot. We have after-hours crisis response services available both on evenings and on weekends through Human Development Center staffs after hours and weekends. Our behavioral health staff within the department, as well as our intake social work staff and existing case managers, have and continue to respond to crisis calls that come directly to our department and not through that regional or statewide or national crisis lines through First Call for Help. Again, Grand Portage Human Services staff continue to respond as they always have and always will to residents. A reminder that this is a pilot project funded with ARPA and some regional crisis funds. This is not a mandated service for our department to provide, but we will continue to get calls in lack of a comprehensive, cohesive, organized response system. Infrastructure is in development locally, regionally, statewide, nationally, in response to the rollout of 988 in 2022. That one-stop call and text line was put out without having the funding and infrastructure in place to fully implement crisis response services. This is not unique to Cook County. Many other communities nationally are responding to crisis calls without a formal infrastructure or staffing, funding in place to respond. All of our teams within Public Health and Human Services, Grand Portage Human Services, law enforcement, North Shore Health are all stretched thin. Despite this being a complex topic for collaboration, it is in our best interest to continue this work, to develop the relationships, the processes, the protocols, to respond consistently across systems. We sent a media release out just before the holidays on what happens when you call 988 or text 988. Again, those calls are routed through First Call for Help, which is our regional crisis line provider. They are dispatched depending on the need that that individual is presenting with to either a mobile crisis responder, to law enforcement, or sometimes the concerns are resolved with information and referral provided over the phone by the crisis responder. Andrea Orist, who's been working to provide interim support to the pilot while the position is vacant, is working to get additional local data, as we have 3 different crisis responders in Cook County and Grand Portage. Those being Human Development Center, providing after hours and weekend response, Public Health and Human Services during the daytime, and Grand Portage Human Services to band members and residents when they are contacted by individuals themselves or through the Cook County Sheriff's Office dispatch. One of the questions that I've received is about lines of jurisdiction. This is very complicated in this area. If someone is in the custody of the Cook County Sheriff's Office or a patient of the North Shore Health Emergency Department, Public Health and Human Services, and the HDC mobile crisis response staff do not have jurisdiction. We can be brought in to support the individual, but the service is voluntary. Our shared goal with this project is to increase collaboration in the spaces where we overlap, those transition points and handoffs. There is no one cookie cutter approach to crisis response. We have a unique community, a unique county in terms of the number of providers. And this all depends on the individual, their hopes, their wishes, their needs, and what system they're interacting with. Again, the goal of this pilot is to create the relationships and the processes to be able to work effectively together and count on each other to provide support in these situations. And that work continues.
Allison?
Yes.
Just to make it more concrete for me,
Mhm.
can you give me a couple of examples of the kind of crisis that would enable the system, that this system would handle? Are we talking about a 747 crashes downtown, or are we talking about an individual who has an immediate emergent need?
That's a great question, Frank, and I think one of the challenges that we've been reckoning with over the last year of this pilot is that everyone has a different definition of crisis, depending on their closeness to the situation, their perspective, their history. I can share a few different examples of a call that might come to our department to provide mobile crisis support. An example might be an individual who is experiencing suicidal thoughts, reaches out to 988 by phone or text during daytime hours. That call is dispatched to First Call for Help out of Grand Rapids. They are using a protocol, a screening tool to determine the risk. And that, again, has been one of our efforts as a department and across systems, is to establish some standards and consistency in the types of screening protocols that we're using to ensure that we have a shared definition of crisis and that we have some consistency in terms of how we're responding based on which system is called to respond. So if that call expressing suicidal thoughts is dispatched in daytime hours, that person is screened as indeed meeting the criteria for a mobile crisis response. That call will come to our front desk, and our front desk has a protocol in place to reach out to John or another supervisor to initiate and offer that mobile crisis response. Again, it's voluntary. A person could say, no, I don't want the county coming to help. And maybe they do. And again, we are putting the infrastructure in place to be able to respond consistently. We might get a call from the school or from a healthcare provider. That could come to us directly or again through that regional crisis line, depending on the individual's need and level of care. A team from our staff may be dispatched to respond. If it's after hours or weekends, that would be a Human Development Center response, as they hold the regional contract for after hours and weekends. It could be a neighbor who has concerns about a friend. It could be a family member. It could be someone looking for resources to support themselves or a family member. Wide range of
Could be
presenting
a
concerns.
business that sees an individual they consider dangerous or causing a disturbance or whatever, in which case, law enforcement would be involved, but then also if it's clear that it's maybe more than a legal case, then the crisis response could be involved there too.
So how would the reporting person know who to call? And there's a specific reason I'm asking this. I'm also an EMT with the Gunflint Trail Volunteer Fire Department. And we recently had an incident where we transported a person who'd been involved in an auto accident, nighttime, to the emergency department. He was checked out. He had to stay for a few hours for observation, but he probably would not need an overnight stay in the hospital. On the other hand, his vehicle is 50 miles up Gunflint Trail. I don't know exactly if he was indigent or not, but I would strongly suspect that he did not have funds to leave the hospital and check into a local motel overnight. So I asked the person staffing the emergency department desk what arrangements could be made. Devil's in the details. She had no clue. Absolutely no idea. Well, we don't admit people just because they have no place else to stay, and I understand that. So what do you do? So there's some communication and maybe some training for the frontline people, so they can know, well, how did the structure and the strategic structure is great, and I commend you for it. But getting down to the actual people who have to push the button and call somebody, that may need some further training for this new program.
Absolutely, Frank, and that is within the scope of responsibilities of our crisis response worker. We don't have the volume of crises for a person to respond to at 40 hours a week.
Right.
So a function of this role is that education and outreach. As we have the systems and relationship built, we can be more assertive in our outreach with community partners, other organizations that interact with people in crisis, as well as the community as a whole, on how to access these crisis support services and when to reach out for support. And again, ensuring that our other medical systems, our other emergency response systems are well informed as to how to make a referral if it's not a crisis, but if someone could use additional support for that transition of care.
Thanks.
Thank you for your question.
And it sounds like, right, the default is 988, and then that'll kind of direct where things are. And in that particular example that you were given, Frank, it sounds like a transportation issue, right? And that's
Transportation, overnight accommodation, something like
Sure.
that.
Yeah. Temporary. Yeah.
In other words, short, like immediate funds.
Yeah, and overnight, that's probably harder. Yeah. But also on our community health goals too, so both of those.
Well, and one of the positions that hasn't been able to be filled is a crisis worker, which probably would be the person to handle that if we had them. You know, that would be the person that would know what to do and help people, so.
All right. Any other questions for now, or should we move on to committee reports? Yep. Active Living Steering Committee, Commissioner White, who is not here. We'll move on to AOA. Commissioner White not here. AHA, Commissioner White not here, but I'm the alternate and subbed in. She had a conflict there, and here I was thinking that it was going to be a quarterly meeting. That's kind of where we were getting at, but now with the transition from the facility formerly known as the Birch Tree Center to with services provided by Thrive to now services provided by HDC, and the renaming and all the legal issues that may be coming. They're talking about more monthly meetings again. Commissioner Patrick Boyle is now the chair of that, and from St. Louis County, and very involved and informed regarding mental health services in the region and in St. Louis County. So pretty excited for that leadership, and just really appreciate the discussions AHA is having regarding the values of the region, the strategy, and just what these changes and different actions would mean when at the end of the day, as far as how many beds are available for the community and what's gonna just work best. So not straightforward, but I think managed and handled very, very well. So and to be continued there as well with the naming and I guess whatever pathways are chosen, both legally and just practically. Arrowhead Regional Corrections, ARC, Commissioner Huggins.
Actually, we haven't met since our last public health. That meeting is on Friday.
Thank you. Child Care Solutions Subcommittee, Commissioner Starley.
Thank you, Mr. Chair. We had a discussion in December about when we should be meeting. We were kind of off and on, and so now we're going to be on. We have a schedule. It's going to be the second Wednesday of the month from 2:30 to 3:30, and we're going to start this on February 14th, which is Valentine's Day. So we'll have to make sure that we have heart when we talk about our child care, and we will.
Thank you, Commissioner Starley. CHB, we have not yet had a meeting for the year. Let's see, Mental Health Advisory Council, Rana.
Well, we met, I brought the wrong notebook, so I don't have all my notes, but I was reelected to be chair, and who is it that
Oh, I
works
just
in
read
Grand
that too.
Portage? Is the associate chair. Heidi Duker,
Thank you.
sorry. So that was supposed to be the time before, but we did it this time. And we talked about the programs in the school, and some of the same things we've talked about here was how the chain of command kind of in different kinds of services and what we can do to be ready for whatever comes along. I can't think of anything else real.
I would add that Brittany Anderson with Grand Portage, who is also a representative representing the Grand Portage Band on the Arrowhead Behavioral Health Initiative, gave a really valuable perspective on the name change with our regional crisis stabilization center, some advocacy that the tribes were leading with regards to maintaining the name of that facility, given the amount of planning and effort and intention that went into that. So I think that was really valuable to have her perspective and leadership on that topic at a regional level. We also talked about the coordinated crisis response pilot and some of our ongoing efforts to build that system in absence of a staff in that position.
Like the birch tree, well,
Yes.
you have to go to Duluth, that's an issue right away from here. If someone's in a crisis, you're not going to get help for 3 hours, Meanwhile, who's driving them, so we've talked about that a lot here, too.
Oh, I was reminded too, just regarding the name change discussion. It sounds like they've already talked about this a little bit in the ABHI group, but I suggested just naming the center whatever Birch is in Ojibwe.
Oh.
There was concern about people thinking it's just for our Native American population then, but then someone also said, well, that's baloney. There's so many lakes and cities and counties named with Ojibwe language that it's part of our regional culture. So, but to be determined. I'm not part of that at all now. So, but
Yeah, and it's just, constant kind of change and churn of how things are done, which just makes it that much harder to get everybody knowing what to do. It's
also true.
nothing, we can't control that, but we just have to work with it. So, sorry, I didn't.
No, that's
my
no.
kind of a-
Thank you. Restorative Justice Committee, Commissioner Hawkins.
The report is there. That meeting is tomorrow.
Great, thank you. Thank you for submitting that. I sheepishly keep failing to submit the AOA annual report, and we'll do that before I leave my chair here today to Alison, so she can share it in our next packet. Thank you for sharing that.
Well, this all is Inger. She takes responsibility for making sure the report we
Cool.
discussed gets sent on to Alison. So
Great.
I really don't have anything to do. It's up to Alison and
Okay.
Inger.
We can still take credit. Council on Aging, Commissioner White. Emergency Preparedness, Commissioner Sullivan.
So we did not meet in January, but we will be meeting beginning in February. And again, that's a bi-monthly group.
Okay, thank you. Healthcare Planning Committee, Commissioner Starley.
We have not met.
Okay, and then NACO.
Yes, we have met.
Uh-huh.
Well, in December, and now next week, in preparation for the national conference in Washington DC, getting our ducks in a row for all of that. And I will not be attending it, but I hopefully will send a few vibes with the
Great.
people that are for the health committee.
Thank you. Northeast Office of Job Training, Commissioner Hawkins.
That meeting is next week.
Yep, thank you. And North Shore Collaborative, we have not yet met there either. Though upcoming is going to be some strategic planning and looking to get more systems in place and just with turnover with group and kind of flexibility within that organization and funds. I think it'll help steer things quite a lot. And then the Public Health PHHS Advisory Council, Frank.
Thank you. We did meet January 2nd and had a couple things I'd like to report. The first thing, with regard to the grant subcommittee, the council approved a resolution that the grant subcommittee in future funding would set aside a portion of the allocated amount for new and innovative small-scale programs, small-scale being defined as, I believe, under $10,000. And that would be reserved for new applicants who have not previously received grant funding, emphasis on innovative programs. And if those awards were not made, then that set aside would simply be rolled back into the general funds. So this would be 2024 applications, which would be then granted in 2025, would be the first time that actually comes into effect.
So we have yet to set the budget for
Right.
that,
So we don't know
those funds.
exactly what
Yep,
we're
yep.
talking about, but there's that. The other thing I'd like to bring up is, as part of my normal day jobs, most of you may know I work at Centers for Disease Control, and the particular part of CDC I work in has to do with supporting state, territorial, local, and tribal health departments. They're the ones that have passed out the infrastructure funds from the CDC, the $4 billion largest ever public health grants and so on. I was recently at a rollout of the new Office of Rural Health. And that's CDC's recognition that rural health is different. It's not just smaller scale, it's different, with very different needs. And the director of that department, I approached her after the meeting, and she agreed that she thought it would be a great idea for her to address us, whatever that means. And that was part of my question that we'd like to bring up here. What does that mean? Would that be something for her to address the commission, the board, the advisory council, the community health board that covers the 4 counties, certainly bringing in the mental health advisory council, or general public, or who? She is open to doing that whenever. So that's something I would like to bring up for discussion. I would like to extend a formal invitation to her, but that's something I think that should come from the board or one of those other agencies, not just Frank calling her on the phone and sending her a Teams message saying, hey, come and talk to us.
Great. Well, naturally, I think this board is a good fit, but then I started thinking more about it and all the community partners, and I feel like the advisory council has, representation from Grand Portage, the hospital, well, maybe not always the hospital, the clinic, hopefully the school district, the hub. So it has a more comprehensive, I think, composition of perspectives there.
Or
But-
should it be an ad hoc meeting? where
Sure,
it's a
yeah.
Come one, come all.
Yep.
That might be nice.
Yep, that would be also very great. I don't know, that's,
And specifically, the reason I'm bringing this up is that would be a good contact then for future support, whether it's grant, technical assistance, or all the other stuff that CDC does. It's nice to know what's available
yeah, and
and what resources are available.
yeah, CHB I think would be really powerful too, just because of the regional
Yeah.
component of it. Commissioner Hawkins?
Yeah, thank you. I was at my first advisory committee meeting on that date, and when Frank brought this up, excuse me, and I was thinking about it later, that I think I don't know if I mentioned it during the meeting or I mentioned it to Alison afterwards. It was like, okay, I know that I kind of read the minutes of the advisory council, but I didn't know who they were. I didn't really follow it. And so that was my first time. Thinking about what Frank brought up made me wonder. Some of the other boards that I serve on that have advisory councils, we meet jointly once a year so that we all know who each other is. And I wondered if this would be an opportunity to have all the boards, all the people involved in all of this work, get together at the same time in the same place to meet each other and make sure we're all hearing the same things. I just was thinking about that. I don't know that's the best idea, but I raised that also. It's helpful for us to be in the same room sometime to get to know each other, I think.
Definitely.
Yeah, and the last year, the Mental Health Advisory Council and the PHHS Advisory Council did have a joint meeting there for that very reason. However, yeah, I don't think the advisory councils have ever met with this board necessarily. But were there other
No,
entities or, okay.
I don't know. I'm kind of new to learning who
Sure.
does what and who's responsible for what. So I'm still sorting that out. I thought maybe that's a way to figure this out easier.
Some people are working, during, take an hour off for, like our meeting, I don't know how many they could do, and still continue their employment, especially like people at the schools and things like that. It's a difficult thing, but I think it would be worthwhile.
Scheduling might be the trickiest thing. And so that was, I guess, maybe another reason why I thought the advisory council, it's already scheduled. If other people can hop on that, it has a wide, like I said, perspective. But we want to be as inclusive as we can and make sure we're all getting the same information too. So that's as good of idea as I have. Also, yeah, just trying to piggyback on a scheduled meeting. It could be at this one, but to your point, I don't know how many people from the two advisory councils would be able to make this meeting. So.
Well, I know we meet at 1, and some people are eating lunch then too, so that it's online. I mean, it's on Zoom, so they could do that. So, but
If it was online
It would be online.
and you also videotaped it so that it's available for the community, I think that would
That's
be a
brilliant.
wonderful way to
Yeah.
manage it.
Good. So people could attend online live,
Mhm.
or,
Or if they're unable to do
Later.
that, they can look at it and get the information later.
yeah, that would be probably easier, especially in the winter, than people physically coming to a place at a certain time.
Well, should we start there and see where further we need to go?
Another idea I'd throw out is partnering with Cook County Higher Education. They have a lot of experience with facilitating remote and hybrid meetings. They have the right equipment and the ability to record it and reach a much larger audience than we are as a department. We've been successful in partnering with them in the past on trainings or lunch and learn format presentations, so that could be an option that I'd be happy to explore with Kelsey and the team
That's a
at
great
Higher
Yeah,
Ed.
that's a great idea. And maybe move it like 12:30 or something, so it could be a lunch for if people, but if that would be good for them.
I think the downside there is, we would want to have it be participative and have a lot of ways to get feedback from providers and community members to help inform your contact at CDC as to how they can best support rural remote areas of the country.
yeah, presumably you'd want to have a chat open
Right.
for real time and be able to follow up as well. And I think this should be publicized, promoted, not only to the boards and councils, but to the general community as well. I think this is a unique opportunity, especially with this starting up office. It actually started before COVID, but then COVID hit and everybody moved over to the emergency and it just languished for 3 years. But now it's being revitalized and restarted after its soft opening, I guess, and now it's the real opening.
And higher ed has, as you say, hybrid capabilities, so maybe they could offer an in-person at their facility for people who, not everybody can do Zoom, so that might
Good.
be helpful too.
Yeah, that's, I think, maybe going to get our widest audience yet is probably higher ed.
So the last question to move ahead and implement this, well, if somebody would, Alison, I guess, would contact higher ed. But on the other hand, on the other side, is the formal invitation should come from the county or from the board or?
So, or it's a piece there, if Alison, if you can investigate higher ed and then maybe connect with Frank about contact and then make their formal request.
We could do a media release to get the word out broadly to local media.
That's good.
I'm happy to take that conversation offline with you, Frank.
Yeah.
And thank you for sharing that. And I don't know if the representative might also have some, targeted, questions for rural communities. There could be opportunities for polls in the presentation or whatever to try to get at some of the.
Yeah, I'll ask her what she would like to hear.
Yep. Thank you. Okay, I think that was the end of the our list there. Betcha there's just good of the order. Anyone else have anything good of the order?
I don't believe so.
Very good. Then we're at the end.
Mills, if I
Oh,
may
yes,
quick,
please.
I'd be remiss to not say that COVID levels are up regionally, hospitalization is up. We continue to make masks and tests available to the public free of charge through our department, through Grand Portage Health Services, a variety of locations throughout the county. We continue to get information out to the public through social media and on our website on how to protect yourself and others from the increased transmission of COVID and other respiratory viruses.
Thank you.
So check our website for isolation and quarantine guidance, when to test, and how to get free tests and masks throughout Cook County.
Do we have numbers of cases, or specific numbers? Do you know off the top of your head? Or?
So we aren't tracking data locally. The state isn't tracking new
Right.
COVID cases. We are experiencing more calls, and we do have the CDC data on COVID-19 hospital admissions. Right now, Cook County is at a medium level based on regional hospital administrations. So within the last week, 71 new hospital admissions of confirmed COVID-19. That isn't just Cook County,
Right.
this is regional data.
Okay.
That's a 34% increase in hospital admissions from the prior week, so pretty significant.
Thank you.
Yeah.
And that brings us to our last item, which is adjournment. So we are adjourned. Thank you.